Welcome to the Nexus. My name is Philemon Chisororo, and I'm happy that you found me. At this moment, I am a fifth-year medical student. In this course, I will be going through basic biology, ordinary level, Cambridge. All right, so we are going to start with transport in animals. And the favorite animal that I will talk about is the human being, right? So this video is going to be just basic human anatomy, focusing on the cardiovascular system, right? So transport in animals. So we will talk about two parts. Firstly, the heart, and in another video, we'll talk about the blood vessels, right? So the first concept that I would like you to master is when we talk about the right side and left side of the human body. All right, so I don't mean your right side, but just imagine that you are a doctor or a nurse, right? You're a physician. We'll be talking about the right side of your patient, right? So this is the right side of the patient, and this is the left side of the patient. So when we talk about heart, right, you know, what's the normal location of the heart? Some people say it's on the left side. Not really. Yeah, it's towards the left, right? But we can't say it's on the left, right? But if you look at this, you will see that this is the left side of the patient, right? Okay. The second concept that I would like you to master is the concept of double circulation. What does this mean? This means the blood has to pass through the heart chambers twice, right? So looking at this scheme, this is the right side and this is the left side, right? So the blood comes from the rest of the body into the heart, and then it will go to the lungs, and after gaseous exchange will oxygenate this blood. It will become red. Deoxygenated is here in bluish and oxygenated is red, right? So via pulmonary veins, not pulmonary artery, right? This is not anatomically correct. And then it will enter the heart again, and then to the rest of the body, and again. So that's double circulation, right? So it's two parts. We have pulmonary circulation and systemic circulation, or pulmonary circuits and systemic circuits. Another term used is what? Lesser circulation and greater circulation, right? So this is the double circulation. But if you think about fish, for example, in fish there is a single circulation. As you can see here, the gills, right? So the blood will go to the gills and will be oxygenated, and then it will go to the rest of the body, like the systemic capillaries there, and you can see blood coming back through the veins, passing through the atrium and then the ventricle, now the artery and back. So the blood is passing through the heart once, not twice, only once. That's the single circulation. But in humans, we have double circulation, in other mammals. Next, the anatomical location of the heart, right? So you can see here is the heart, right? So it's located in the chest cavity, right? And I told you it's slightly to the left, right? It's between the lungs. So these are the lungs, and these are great vessels, right? Superior vena cava, the aorta, and the pulmonary trunk. I will talk about these as we proceed, right? But I just want to you to understand that the heart is not in the abdominal cavity, but in the chest. You can see it's above the diaphragm, the important muscle for respiration. We'll talk about it in the respiratory system, right? So on the left and right, we have the lungs. On the back, you have organs like trachea and bronchi. That's where the bifurcation will take place. Bifurcation is when the trachea will branch into the right and left bronchi. And on the again on the back of the side, you find the esophagus, and you find the thoracic vertebrae, right? Big terms. We will talk about them in other videos, right? And anteriorly, you find the breastbone or the sternum. Okay, so the internal structure of the heart, right? So basically, the heart has 4 chambers, 2 atria and 2 ventricles, right? So this is the left atrium. I told you where the left is. This is not right, it's left of your patient. Remember, left atrium, right atrium, left ventricle, right ventricle, right? And these heart chambers, the ventricle and the atria, yeah, the ventricles, that's plural. The atrium is one, atria, that's plural, right? So the ventricles and the atria are separated by a septum, right? So on this part, you can actually see it. It's called interventricular septum, separating the right and left ventricles, right? Okay. Here you see this great vessel, the superior vena cava. It drains blood from the upper part of the body, right? And the inferior vena cava from the lower part of the body, and the abdominal organs, right? Here you can see the pulmonary trunk. So this pulmonary trunk, it drains, it takes the blood from the right ventricle to the lungs, right? How does it do this? It bifurcates into right and left pulmonary arteries, right? And these will go to their respective lungs. And then coming back, the blood will come back from the lungs, both of them, like so each lung will produce 2 pulmonary veins, and these veins, all of them, therefore they drain into the left atrium, right? So this is another concept that I want you to master, right? In general, we say veins usually carry deoxygenated blood and arteries carry oxygenated blood, right? So in the heart, if we talk about the pulmonary artery, this is an exception. The pulmonary artery, the left and right pulmonary arteries, they carry deoxygenated blood, these 2 arteries, to the lungs. And the 4 veins, the pulmonary veins, they carry oxygenated blood. So you see, veins in general, they carry deoxygenated, but pulmonary veins, they carry oxygenated blood, right? Okay. Next we'll talk about heart valves, right? So valves are very important. What's the function of a valve? Is prevention of backflow, right? So we don't want any backflow. So in this case, here we can see these valves. This is the blood will come through the pulmonary veins to the atria, and then from this atrium, from this left atrium, it will go to the left ventricle via the mitral valve or bicuspid valve. I will show you the cusps, right? And then it will be pumped, and then to the rest of the body via the aorta, right? And then it will come back in through different veins, forming the inferior vena cava and superior vena cava, and then the blood will be in the right atrium, and then from the right atrium it will go to the right ventricle via the tricuspid valve, and from here the blood will go via the pulmonary valve to the pulmonary trunk, and then it will be separated into right and left pulmonary arteries, right? So I talked about these 3 valves. I just skipped this aortic, right? So from the left atrium to the left ventricle is mitral valve. From the left ventricle to the aorta is aortic valve. From the right atrium to the right ventricle is the tricuspid valve. And from the right ventricle to the pulmonary artery is through the pulmonary valve, right? So this is the interventricular septum. What's the significance of this? It separates oxygenated blood from deoxygenated. Where do you find oxygenated blood? Mainly here in the left ventricle. And where do you find deoxygenated? In the right ventricle, right? So another concept, yeah, I just take this opportunity to explain to you. You know, if you talk about the thickness of the myocardium, right, you will see that the left ventricle is more thicker because it has to pump blood to different parts of the body which are a little far, right? And this one, you'll find it is thin, the right ventricle, because it's only pumping blood to the lungs. Okay, so let's focus on the valves again, another view, right? So this is the superior view, and this is the posterior side. Posterior is to the back, anterior is to the front, right? So you are looking at these valves using this view, right? So this is the mitral valve. It's called bicuspid because it has two cusps, 1, 2. Here is the tricuspid valve. Tricuspid because it has 3 cusps, 1, 2, 3, right? Okay, so this is the right side, this is the left side. Okay, and here you see the semilunar valves. These two are called semilunar valves, and they have 3 leaflets, all of them, right? This is the aortic, and this is the pulmonary valve. All right. Okay, so if we look closely to this valve, we will see that okay, let me show you one thing. If there is high pressure here, blood will be forced to go back to the left atrium, right? So we need something that can hold this valve in this position so that there is no backflow. There is no, right? So this term is called regurgitation. If it's happening here, this is called mitral regurgitation, right? It's an amazing condition. We will talk about it later, okay? Maybe when we are doctors or in medical school, right? Okay, let's continue. Right, so I said we want to make sure that these valves are at one point, right? They are not moving back, they are not causing backflow, right? So if you look here, there are some muscles here. These muscles are called papillary muscles, right? These are called the papillary muscles in the zoomed image. And between the valve and the papillary muscles, you have these tendons. They are called tendinous cords or corda tendine. Corda tendine is Latin, but tendinous cords, perfect. You just need to remember that. Right, let's go through the blood flow through the heart again. Okay, right, so blood come from the upper body via the superior vena cava and from the lower body via the inferior vena cava, and it will enter the right atrium. Then from the right atrium through the tricuspid valve we go to the right ventricle. From the right ventricle we go through the pulmonary valve to the pulmonary trunk, and the pulmonary trunk will bifurcate or divide into right and left pulmonary arteries, going where? Going to the lungs for gaseous exchange, right? So oxygenated blood now will come back through the 4 pulmonary veins, 1, 2, 3, 4, 3, 4, right? So this and this one is just going posteriorly, but they are all draining into the left atrium, these 4, right? So from the left atrium we'll go through the mitral or bicuspid valve into the left ventricles, and then from the left ventricle the blood will be pumped through the aortic valve, aortic arch, and the aorta will give big branches, and the rest of the body we're supplying it, and then the blood will come back again through the superior and inferior vena cava, right? So I told you this, you can see the thickness. You need to remember the concept of thickness of ventricles, right? I said this one is thicker and the left ventricle because it pumps blood to the rest of the body, and the right ventricle only to the lungs, right? Okay, so a little bit of histology, because here is something cool that I want to tell you, right? So the heart in general is like 2 kinds of cells. the first group is the ability to conduct electricity, right? So they are called conducting cells, and these will make an important structure called the conducting system of the heart, right? So the first part is called the sinus node or SA node, right? So it's found between the superior vena cava and the right atrium is here. So this sinus node produces a sinus rhythm of 60 to 100 beats per minute. Thus the heart rate, 60 to 100 beats per minute, right? So if the heart rate is below 60, it's called bradycardia. Bradycardia. If the heart rate is more than 100 beats per minute, it's called tachycardia. Tachycardia. Okay, cool. Right, so this sinus rhythm will go through the atrioventricular node or the AV node, then the bundle of his, and then the bundle of his will divide it into right and left bundle branch, and then the Purkinje fibers, right? So that's the basic conducting system of the heart. Next will be the contractile cells, right? These are cardiomyocytes. They have ability to contract, right? So this is a special muscle, right? So you can see here, this layer is called myocardium. All right, so let's cut here. Let's have a zoomed view of this. So inside, close to the blood will be within the ventricles, right? Very close. You will find a layer called endocardium, right? And then next you will find the myocardium. It's very thick, right? So that's the contractile part. And then from there you find the epicardium. It's called a visceral layer of the serous pericardium, right? All right, I just want to tell you these two terms, parietal and visceral. You know, like internal organs, we can call them visceral organs, right? So visceral is internal, right? So the internal layer, or the layer that covers an organ, like this is called a visceral layer. And then the parietal layer, it covers, we can say it covers the wall, right? Yeah, something like that, right? So this is the epicardium, or the visceral layer of the serous pericardium. Next here is the pericardial cavity, right? So there is a little fluid here, and outside that's the parietal layer of the serous pericardium, right? And then outside you have the fibrous pericardium, right? So pericardium is two parts, the serous part and the fibrous part, right? So the serous pericardium is visceral layer which attaches to the heart like intimately, and then we have a space called the pericardial cavity with little fluid, allows the movement of the heart so that there is no friction. And then outside we have the parietal pericardium, and outside the parietal pericardium we have the fibrous pericardium. Cool. Right. Again, now let's talk about these definitions. You need to know them. Heart rate. So I told you that heart rate is the number of heart contractions per minute, beats per minute. Usually it's 60 to 100 beats per minute, right? Next, you need to know a stroke volume. Stroke volume. What is this stroke volume? It's the volume of blood pumped by the left or right ventricles in a single heartbeat. The volume pumped at one contraction by both like right or left ventricles, right? So what's the formula of the stroke volume, right? Okay, so stroke volume is called end diastolic volume minus end systolic volume. What is systole and what is diastole, right? I need active learners, so Google diastole and Google systole and tell me what it means in the comment section. Right, so next will be ejection fraction. What is ejection fraction? This is the proportion of the end diastolic volume ejected from the ventricle, right? And the formula for ejection fraction is stroke volume divided by end diastolic volume, right? So again, systolic volume, you can put it here, right? Because this is the systolic volume end diastolic volume minus end systolic volume divided by end diastolic volume. Right. So in in general, under normal conditions, it's about 50 to 70%, and this serves as an index of myocardial contractility. For example, in a low myocardial contractility will lead to low ejection fraction, as seen in systolic heart failure, where the ejection fraction will be less than 40%, because in general it's 50 to 70, right? Right, so the ejection fraction is low in systolic heart failure and usually normal in diastolic heart failure. Right, the next term is venous return. Venous return is clear cut, right? This is the rate at which blood flows back to the heart, which typically equals to the cardiac output. So what the hell is cardiac output? This is the volume of blood the heart pumps through the circulatory system per minute, right? So it's approximately 5 liters at rest. And the formula for cardiac output is heart rate times stroke volume. Heart rate times stroke volume. Okay. Next, I would like to tell you about the effects of exercises, right, on the heart in general, right? So short-term effects first. Increase in heart rate, increase in venous return, increase in stroke volume because of the Starling law. Starling law, Google it, Starling law, Google it, and tell me what it means, because if I tell you everything, guys, you won't be able to learn on your own, right? So Google these buzzwords, they will help you. Starling law is it's some, all right, I'm not going to tell you. All right, so next is the cardiac output. It also increases due to the fact that the cardiac output is called heart rate times the stroke volume, because I told you the stroke volume and the heart rate increases. It means the cardiac output will be increased too, right? So these are the short-term effects, right? So next will be the long-term effects. So these will be the effects on the heart itself, right? So the heart becomes bigger. It's called hypertrophy, right? So let's talk about like boat athletes. Okay, I like boat guys, right? So in athletes, they have like this hypertrophy is physiologic, it's not pathologic, and it means the walls of this of the heart become thicker and stronger, and the stroke volume increases, and the result of this is that the heart will become a more efficient pump, right? So in general, at rest, your heart rate will get slower as you get fitter, right? So the heart rate will be like down towards 65, 70, right? Compared to someone who doesn't exercise at all, where you always find the heart rate higher, close to 100. Right, so this happens because the heart needs fewer beats to pump blood around the heart, because I said the stroke volume of an athlete, of a fit person, is high, so you don't need to pump a lot. Just a single pump will eject a lot of blood, so you don't need to make a lot of those pumps, right? Then training will also result in new capillaries growing to improve the supply of blood to muscles, right? So those who exercise, they have like this development of new blood vessels, capillaries. It's called angiogenesis, right? Development of new blood vessels because they exercise. So that's the thing, right? They have a good supply of oxygen in those big muscles, right? Now we talked about like different functions of the heart, but where does it get blood? The heart itself, right? So it's called a coronary circulation, right? So the heart is supplied by the coronary arteries, right? Where do they come from? The coronary arteries, they come from this first part of aorta. You can see it here on the left and here on the right. This is the left coronary artery. This is the right coronary artery, right? But look at this. This is an amazing piece of physiology, right? So when you pump blood during systole, blood will go out and the valves will close, because these are the openings, or the beginning of these coronary arteries is, let's say this is the valve leaflet, right? These are the valve leaflets, right? So during systole they will be like this, and diastole like this. So we are opening this. This is where you find the arteries, right? The coronary arteries. That's where they begin, right? Systole, diastole, systole, diastole, systole, diastole. So the heart itself gets blood through diastole. Cool, right? So you have the left coronary artery. It gives a very big branch called circumflex artery, left circumflex artery. And this one is a left anterior descending artery, and here is the right coronary artery. All right, so we'll talk about other small branches of the coronary arteries later, right? But for now, just to know that the heart get blood from the coronary arteries, right? So what about drainage, right? So the heart drains into the coronary sinus, and the coronary sinus will drain into the right atrium, and then from the right atrium, the blood will go to the right ventricle, and then it will be pumped out, right? So those indicated there are the veins of the heart, the veins which drain the blood from the heart, right? Okay, so an introduction to coronary heart diseases, because in your syllabus they want you to know. So arteriosclerosis is thickening or hardening of the arterial wall and the loss of its elasticity, right, caused by different things. And an example of arteriosclerosis is atherosclerosis, right? Atherosclerosis. What the hell is it, right? So this is a multifactorial inflammatory disease of the intima, manifesting at points of hemodynamic shear and stress, right? So it's characterized by build-up of cholesterol plaques in the intima, and this will affect the elasticity of the different arteries, like large arteries, medium arteries, medium muscular arteries. We'll talk about types of arteries later, but in this case, okay, I think I have nice. Okay, cool. Let me find a place here. All right, so in general, this is a healthy artery, right? So this is a healthy artery, and if you expose yourself to different risk factors, which I will talk about, the cholesterol will start accumulating in the tunica intima, right? And then tunica media, right? And you can see here is narrowing. You can see it both sides, and here this is severe narrowing to the extent of blocking the whole artery, right? So if you block, the heart itself will die of ischemia, right? It will form an infarct. It's called myocardial infarction, right? It's mainly caused by these conditions called atherosclerosis, right? Okay. All right, so these are some of the risk factors of atherosclerosis. So this can be divided into two groups: modifiable risk factors and non-modifiable risk factors. Modifiable meaning to say we can reduce them, right? But non-modifiable, there's nothing we can do about it, right? So we can stop smoking, because smoking is the risk factor, right? Another risk factor is diabetes, arterial hypertension, dyslipidemia. This is disbalance between the lipoproteins, like those low density lipoprotein, high density lipoprotein, right? High density is healthy cholesterol, and low density is bad cholesterol, right? So what should be high? Low density lipoprotein or high density lipoprotein? It's high density. It should be high under normal circumstances, and low density lipoprotein should be very low, because if it's high, it begins depositing cholesterol in different organs, and that's causing atherosclerosis, because it will be depositing in the blood vessels too, right? Another risk factor is obesity, stress, and increased alcohol consumption. Cool. Unmodifiable diseases, right? So this is genetics, family history, right? So if in your family, if someone like a male had this cardiovascular event below 55, or a female below 65, that's the thing. It's a risk factor, and there's nothing we can do about it. And also age, right? So if we talk about age, um, males above the age of 45 years and females above the age of 55 years, right? Post menopause, after menopause. Why? Because like estrogen, females have high estrogen. It reduces the cardiovascular events, those formation of atherosclerosis, etc. Estrogen reduces that, so males are at more risk of having coronary artery disease than females. Cool. I mean females in gestational age, right? Let's just say like after menarche and before menopause, right? So after menopause, then they will be at risk, right? Okay, I hope you understand that part. How do we treat coronary artery disease or coronary heart disease, right? So there's something called angina. Angina is chest pain, where someone will feel like there's an elephant on his or her chest, right? This is called anginal pain, right? So there are drugs which you can use, and the goal of the anti-anginal drug is to reduce the myocardial oxygen demand, right? An example is a nitrate called nitroglycerin. We can also use beta blockers, calcium channel blockers, etc. And next will be statins. Statins are drugs which reduce the synthesis of cholesterol, right? An example is atorvastatin, simvastatin, right? So they end with statin, so it's easy. We can also use anticoagulants, right? Anticoagulants like aspirin or clopidogrel, like clopidogrel in patients with contraindications to aspirin, right? So why do we need anticoagulations, right? Because like this atherosclerosis, okay, let me show you on this slide, right? So let's say it happens here, right? And then there is a tear like in this, because it's well protected, right? But if there is a tear, the platelets will come here, and the platelets will cause a clot here, which can be dislodged, and then it will go around the tissues, right? So that can block small vessels. We need to destroy that, or to reduce the events of formation of those clots. We use anticoagulants. Right, so this is the medicinal management of the coronary artery disease. If the disease is extensive, we can employ surgical manipulations. Right, so the first thing, you need to put a cardiac catheter. It's called cardiac catheterization. Right, so in this case, we're going to use the Seldinger's technique. Right, so in this technique, you need to find a desired peripheral artery, and then we punch it using a needle with a hole, right? It's called a hollow needle, or a trocar, right? So this is a trocar. You can see it on number 1, right? So initially we can actually see blood here. If we see blood here, then we will be sure that the puncture is successful. And then on number 2, we insert a guide wire, right? So we insert a guide wire, and then on number 3, we remove the trocar. Right now, only the guide wire is here. And on number 4, we can see the introducer sheath, right? So this sheath is passed over the guide wire into the blood vessel, and then this introducer may be used to insert like devices like stents or balloons, right, as we are going to see next. Right, so here, as you can see, you have an atherosclerotic plaque, right, which is narrowing the blood vessel, the coronary artery, right? So you can insert a balloon catheter, right? This is a stent, and then we'll inflate the balloon, right? It will make the it will increase the radius at this level of narrowing or stenosis. We can also use a stent which will stay there, usually coated with anticoagulant. It prevents blood coagulation, right? So we can use a balloon catheter or we can use a stent, right? Another method is called coronary artery bypass grafting, right? So this grafting, we can use a saphenous vein. A saphenous vein, you can find it from your leg. That's where you find the saphenous vein, right? So you take it and then you graft it here, because here you can see there is atherosclerosis here. There is coronary artery disease is extensive here. So you need to skip it. You need to give this myocardium at this level blood supply. So you take from the aorta and then you make sure you skip the level where the damage is, right? That's the first part. Another way is to use, in this one, there is arterial graft, right? So in this case, we use internal thoracic artery graft. I will tell you about internal thoracic artery, right? But in coronary artery bypass grafting, you can either use the saphenous vein, right, from the long saphenous vein from the leg, or you can use the arterial graft from the internal thoracic artery as an example here. Then lastly, I would like to talk about the electrocardiogram, or short for ECG, right? So this is a machine which can record the electrical activity of the heart, and it will print this information on the electrocardiograph, right? So the general wave of the ECG, it looks like this, right? So all right, so firstly, this straight line, let's just imagine this is a straight line. It's called an isoelectric line. Isoelectric line. A positive deflection is going up and negative deflection going down, right? So let's just go through this, right? So you can see the first part, the first upward deflection is called the P wave. P wave, and the P wave, it indicates atrial depolarization. Then there is a certain delay. There is a delay between P wave and the next one, which is QRS complex. This delay is called a PR segment. And then from there is a ventricular depolarization. I said ventricular depolarization is indicated by the QRS complex. And then the ventricular repolarization is indicated by the T wave. This is the T wave, ventricular repolarization. And I said on the straight line, it means no electrical activity, right? So that's isoelectric line, right? One more time. So if you look here, the first positive is P wave, and straight we have PR segment, and then QRS complex, QRS complex, and then you have the T wave, right? T wave, I said, is ventricular repolarization, right? So here on this ECG, like what I only told you is ventricular depolarization and repolarization, but on atria, I only mentioned atrial depolarization. Where is repolarization? That's the question. Okay, so I'll just tell you this one. Repolarization of the atria is buried within the QRS complex. Easy. Thank you so much. Thank you for watching. If you enjoyed this video, please make sure you give it a thumbs up and don't forget to subscribe. Also, tell me what you think in the comment section. Right, so guys, we are going to cover biology, O level and A level. That's AS Cambridge mainly. We'll also cover mathematics, chemistry, physics. I'm going to call different teachers who will be presenting here, right? So just share with your friends and tell him or her that the Nexus is here. Behold the new.